This is Governor Steve Beshear along with First Lady Jane Beshear about Kentucky. When I became governor in 2007, Kentuckians had lost faith in their government, and a global recession was threatening our jobs, our homes, and our health care. But by working together and crossing party lines, we not only helped our families and businesses survive the recession, but also began addressing fundamental weaknesses that have held Kentucky back for generations.
One of the biggest of these weaknesses is poor health. The collective health of Kentucky residents has long been among the worst in the nation. The effect on our families has been terrible, with too many people dying early or suffering chronic illness and disease, unable to enjoy their lives.
The impact on the state has been equally large and negative. There's a direct line between poor health and almost every challenge Kentucky faces, whether that's poverty, unemployment, lags in education attainment, substance abuse, or crime.
Big problems like this require big solutions, and we've employed many.
Over the last 8 years, we've undertaken a fundamental overhaul of core elements like how people access care, how that health care is delivered, who can access that care, and what services they receive. This has been reform with a capital R. The scope of the changes is broad. Wider use of electronic medical records, a new delivery model for Medicaid that focuses on better health outcomes, expansion of Medicaid eligibility standards, creation of a state-run health benefit exchange through which families can purchase private health insurance, and expanded access to substance abuse and behavioral health treatment. Health experts around the country are calling Kentucky a national leader, and our aggressive embrace of federal health care reform has brought coverage to well over 500,000 Kentuckians, most of whom didn't have health insurance. In fact, we've cut the number of uninsured Kentuckians by over half.
Because of these changes, Kentucky residents no longer have to choose between medicine and food, skip checkups, or ignore troubling signs like a lump or pain, praying that those don't develop into a chronic disease or fatal illness. And the numbers of people who are taking control of their health by getting cancer screenings, physicals, and dental checkups has skyrocketed. The Office of the First Lady has complemented these efforts with a variety of health-related programs, including Horses and Hope, which began by providing breast cancer screenings, education, and awareness to Kentucky's equine industry employees and their families. Next year, we'll expand the program by funding a mobile cancer screening van equipped to screen for 7 different cancers that will serve at-risk population throughout the state.
Reducing cancer-related deaths is one of the 7 specific goals of Kentucky Health Now, a broad initiative we created a couple of years ago to attack stubborn health problems like obesity, smoking, dental decay, and heart disease. We've made great progress on these goals, and the impact on Kentuckians has been tremendous. The First Lady and I have heard countless stories and have received myriad emails from people who say they enjoy improved health, better financial security, and, most of all, hope for the first time in a while.
But there is a lot of work left to do. Thank you to the many people, organizations, and agencies who partnered with us to improve our family's health.
And thank you for allowing me to serve as your governor.